Yeah, so now we're gonna talk about the hip joint. Structures, developmental dysplasia of the hip. Now, we split the question again as just the overview of the hip joint, the tissues and ligaments present in and around the joint, the movements of the joint, and developmental dysplasia of the hip. So, what is the hip joint? It's basically the joint formed by the head of the femur going into the acetabulum of the hip bone. So the hip bone is a pollen socket joint, and the joint capsule starts from the rim of the acetabulum and then spreads around the neck of the femur, specifically between like the trochanthers, all around the trochanthers, basically. Yeah, as you can see here, and it's a simple joint. The ligaments present around the joint. This is important, very important to remember. First one being the pubofemoral. As in the name, it would start from the pubic bone to the femur. So specifically, it's on the anterior inferior side of the joint capsule from the obturator crest to the intertrochanteric line. That would be the green one over here. And now the ischiofemoral joint, starting from the ischium to the neck of the femur, but going around and it merges with the zona orbicularis in the front. We'll come to that later. And this is generally like the weakest one out of the three main ones. And now the iliofemoral ligament. It's on the anterior and lateral aspect of the joint capsule and starts from the anterior inferior iliac spine and goes to and from the rim of the acetabulum to the trochanteric line and laterally to the capsule over here. Yeah, and this is the thickest one and the strongest one in general out of the three. And the zona orbicularis now, it's the one that goes around the neck of the femur and basically around the capsule, which merges with the ischiofemoral ligament. And oh yeah, I forgot to mention this, but ischiofemoral prevents hyper extension of the hip joint. And the ligament of the head of the femur is actually a remnant of the artery to the head of the femur, and it's present inside the capsule itself, inside the joint capsule. And as you can see, there is a fat pad within this, basically a moon-shaped structure. This would be the lunate surface of the acetabulum, the majorly the smooth surface where it articulates with the head of the femur. And there's one more ligament I forgot to mention, but it's the transverse acetabular ligament, completes the moon, and within that is a fat pad for shock absorption. And now the different types of movements of the hip joint: extension, flexion. Extension would be this action of lifting your leg front. Um I mean, extension would be lifting your leg backwards, and flexion would be lifting your leg up, and abduction would be bringing your leg together. I mean, abduction would be spreading your legs apart, and adduction would be bringing your legs together. Lateral rotation, where you pivot your feet outwards, and medial rotation, where you pivot your feet inwards. And these are the respective muscles that make the movement. And right now, this may just look as just seem as names to you, but it'll make sense when you go with the actual muscles, the origin and insertion. It'll help you gain an understanding in how it's making that motion possible. You'll go through that later in the muscle quadruplets. And this you don't need to remember the exact degrees of motion, but generally see how movable that part is. Basically, you can flex your hip joint more than you can extend it. Abduction and adduction is relatively equal, and external rotation, internal rotation, you can externally rotate it more than internally rotate it. just all that. Now, developmental dysplasia of the hip. It is basically the problem when the in it happens in babies, from either it is born with it or it gradually happens over the first year of life, where the head of the femur doesn't fit into the acetabulum. It may either be not it 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 may not be deep enough. The acetabulum may not be deep enough to hold the femur head of the femur in, or either the ligaments around the joint capsule is loose. This the femur can move freely in or out of the socket. So if the femur slips out a bit and is not completely in the socket but not completely out of the socket, is known as subluxation. And as you can see in the picture, if it progresses even more, it can lead to dislocation, and in a severe case like high dislocation. And ways to cure it is basically only surgery, where they would deepen the socket, and that's about it.